If you want to feel stronger, the team at the Form Lab can help you with that. We are here today with James Townsend, who is a physical therapist. We also have 207 producer Aaron Tangway, who is, you're not a dummy, but we're going to call you a dummy. He's here with us as well to kind of demonstrate what we're doing today, because you're going to show us a couple different things. What are we going to be doing today?
Yeah, we're going to be two things. We're going to do two things that I do as a physical therapist here. One is going to be a treatment. The first thing we're doing here with Aaron is going to be something called shockwave therapy. And then we're going to take him through a little bit of an agility as part of a testing program that we call hop testing.
Awesome. And all of these things, of course, will help you get the most out of your workout. So what is shockwave therapy?
Yeah, shockwave therapy here is a modality that we use with patients who have an injury that is a soft tissue injury, tendon, tendinitis, tendinopathy. We use it to help reduce inflammation locally, increase blood flow, which ultimately reduces pain and can improve the function of a muscle or of a tendon.
Right.
Yeah.
Right. Okay, so let's see how it works.
Yeah, so in this example here, Aaron is coming with a raging case of tennis elbow, and so we're going to use shockwave therapy to treat that. It's great for all sorts of tendons. We see it a lot for people that have Achilles tendinitis, plantar fasciitis, tendon issues of their rotator cuff, or their lateral epicondyle, which is also known as tennis elbow. So basically, this is just a little bit of ultrasound gel, Aaron, that we use so it doesn't irritate the skin. And how this guy works is it uses something we call mechanotransduction. All right, a mechanical transduction kind of works into the tendon deeper to penetrate at the cellular level to reduce that inflammation, increase blood supply, ultimately reducing inflammation and improving the function of a tendon.
Yeah.
All right, so it gets a little bit loud, that's the only thing. It's kind of like using a Theragun, but a little bit stronger. So it kind of has that vibration and then it just makes a little bit of noise. So we're gonna do a quick demo here. Typically the treatment takes about like 7 to 8 minutes, and it's usually at a level that is very well tolerated, and it just makes a couple of noises like that. And so we do this over the area to, again, reduce that inflammation, increase blood flow.
Okay, so I'm hearing that. What is he feeling when this is going on?
Yeah, so what he should be feeling is just a little bit of pressure, a little bit of vibration that is going down into that tendon, the piston that is just kind of making noise. Again, it's a pressure sensation, shouldn't really exceed like a 3 out of 10 on the pain scale.
You doing okay?
That's all. How does it feel to you?
Yeah. So and you said how often should you be doing something like this?
Usually all the evidence shows to doing it like 1 or 2 times per week over the course of 4 to 6 weeks to get a better change of reduced pain, reduced inflammation. Yeah.
Because it might be an obvious question, but how is that going to help you get more out of your workout?
Yeah, exactly. So by reducing pain, improving strength, that people are able to just do more. Right? So desensitizing some of the pain allows you to move better, have improved range of motion, have improved strength with whatever exercise or activity it is that you're doing.
Awesome. Is there anything more to show with this, or should we hop over to the other test?
I think this is good enough. Again, the whole treatment only takes about 5 to 7 minutes, but we're going to spare that, Aaron, and not do the whole treatment. This is just kind of what it feels like and what it entails.
Awesome. Okay,
Yeah.
so let's go do the other test.
Great. Okay, so now we're here to review hop testing, which is a series of tests that we use in PT to determine if someone is ready to return to play or athletic activity. So when someone comes to see me for a lower extremity injury, ankle, knee, hip, it's really important that they have the strength, the control, and the agility to be able to absorb landing, accelerating, decelerating, changing of direction, that sort of thing. And so before I can feel confident in clearing someone to return to play, this is one of the measures I'm going to look at. So again, we call this hop testing. There's a series of tests that we do. I'm going to take Aaron through 1, maybe 2 tests here to sort of see if he's ready to return to play. So the first one is just called a single leg hop for distance. So we're starting on the uninjured side here. So this is Aaron's healthy leg. And what you're going to do, Aaron, is just take 1 hop and try to stick the landing before you put your other foot down. Good, not too bad, little bit, that was great distance.
Impressed.
That was great distance, come on back. But what we're looking for is I want you to try to stick that landing, all right, and have good, nice, soft landing and good control. Go ahead and try again. Better, nice, and then you put your other foot down. And then we're gonna back up, and now we're gonna do the same thing on the other side. And what I'm looking for, kind of subjectively, is how is he landing? Can he stick that landing? What's his knee doing? What's his hip doing? Sort of looking at those things to determine what his kind of motor control is like, as well as measuring the distance objectively. So I would take my tape measure, measure the distance, compare it side to side for distance, as well as those kind of landing criteria that I was talking about. Can we try one more? So the next hop, Aaron, actually, what you're going to do is you're going to do 3 hops in a row. All right, we call this the triple hop. All right, it's a little more challenging. It's a little more advanced. You're going to take 3 hops, landing on the third one. Okay. 1, 2, 3. Nice. Look at that. Great job. And great landing there on that last one. And then we'd have you come back, and I would do the same thing on your other limb. When you're ready. Good. 1, 2, 3. Good. And a pretty decent landing there. If this was really the clinic, you were my patient, I would definitely work on refining kind of maybe some of that landing, and again, identifying are there any issues side to side in terms of strength or motor control. Great job, though.
And we were talking, too, about how this is kind of key to making sure that people don't re-injure themselves if they're going to work out after they've been injured.
Exactly, right? If we send someone back to sport or back to participation too soon, there's always a risk of re-injury. This is one of the tests, one of many battery of tests that we would do to ensure that they are safe to return.
Awesome. Great information.
Yeah,
Thanks, James.
great.
Good to work with you. If you would like to learn more about everything we covered today at the Forum Lab, just head to the 207 section of our website and app, and don't go anywhere. We're back right after this.